Dr Aseem Malhotra is a British cardiologist and advisor to the UK's National Obesity Forum. He was a member of that obesity steering group set up by the Academy of Medical Royal Colleges, which was the first to recommend a tax on sugary drinks. He's argued that unless sugar consumption is reduced, there'll be a rapid increase in chronic health conditions with serious consequences. Dr Malhotra is in Australia for a series of public lectures. He joined me a short time ago here in the studio. Dr Aseem Malhotra, welcome to Late Line.
Thank you.
Is there now conclusive evidence that eating and drinking added sugars in the diet will lead to type 2 diabetes and obesity?
Well, I think the first thing to say, Emma, looking at the bigger picture, is that we have had an epidemic of misinformation on diet and health, which has caused an epidemic of ill health. Because of flawed science, over 30 years, we have wrongly demonized fats. And when the focus should have been on sugar. The evidence has been emerging over the last few years that has very strongly linked the consumption of sugary drinks and excess sugar to type 2 diabetes and obesity. And with type 2 diabetes, what's interesting, Emma, is this is independent of calories. So that even if you're normal weight, even if you exercise and you consume too much sugar, it's going to increase your risk of developing type 2 diabetes.
Now, Australians are consuming around 26 teaspoons of sugar a day, which seems fairly extraordinary. Is that because a lot of it is hidden in foods that might otherwise be marketed as healthy?
Emma, that's a very good point, and that's part of that misinformation. So the World Health Organization has now recommended a maximum limit of 6 teaspoons of added sugar per day for an adult. And, 26 teaspoons is really quite staggering. And part of the reason for that, as you've alluded to, is because of hidden sugars. So in the United States, and there's no reason to believe that it's different here or in the UK, about a third of sugar consumption comes from sugary drinks. About a sixth comes from foods that people normally associate as being junk food, like ice creams and biscuits, for example. But almost half of sugar consumption comes from foods that people don't think have sugar in them, like salad dressings, ketchup, low-fat yogurt. So it's hidden sugar. And that, in a way, is really quite deceiving. It's quite scandalous. People are buying products that are marketed as being healthy or low-fat, which are loaded with excess sugar. And therefore, it makes it difficult for them to exercise personal responsibility, because the food industry know that people will buy products based on the way they're marketed and promoted, not on the nutritional value.
So what you're telling me is that when I pick up my zero-fat yogurt and give myself a great pat on the back, I'm kidding myself.
Well, I think the first thing to say is actually we should, you're right, absolutely. We should stop demonizing fat. Fat is your friend. And in fact, I tell all my patients, like I would tell the public, do not buy anything, or be very wary of buying anything that's marketed as fat-free or low-fat. I say go for the whole food, the full-fat products. It's actually going to be much better for your health. But also, yes, some of these fat-free foods, low-fat foods, are loaded with excess sugar, which is going to damage your health, not do you any good.
So if you are obese or suffering already from diabetes, can you improve your health by limiting your sugar consumption?
Absolutely, Emma. And what I would say is there's very good evidence and very good studies that actually show that if you reduce your refined carbohydrates, and sugar is one of those carbohydrates, and other carbohydrates like white bread and carbohydrates that don't have fibre, and you eat a lot more fat, then actually what happens is there is good evidence that it can reverse type 2 diabetes, or at the very least reduce the need for medications. And the interesting thing is the impact on that can be quite quick. So, for example, there was some studies done in the United Kingdom. Oxford University did a study looking at what would be the effect of introducing a 20% tax on sugary drinks. Across the population in the UK, that would reduce sugar consumption by about 15%. But what's really fascinating is that within 1 year of a 20% tax on sugary drinks, that would prevent about 180,000 people in the UK from becoming obese, just from reducing the consumption. So the effects are quite rapid.
Australia's Rural Health Minister Fiona Nash has ruled out following the UK's lead on a tax on sugary soft drinks. She prefers a higher tobacco tax because, in her words, cigarettes are far worse for people's health than obesity. What's your view on that?
Well, actually, I would say that is not in keeping with the current science. The Lancet Global Burden of Disease reports actually now reveals that poor diet is responsible for more disease and death than physical inactivity, smoking and alcohol combined. And although I would support certainly her calls for taxing tobacco, because we know taxes do reduce consumption, the same should now apply to sugary drinks, because the impact of type 2 diabetes and obesity currently is far greater in developed countries than the impact of tobacco. We have been very successful in reducing tobacco prevalence because we've concentrated on what we call the 3 A's in public health, targeting the availability, the affordability and the acceptability. We need to apply the same principles to sugar.
Fiona Nash says the role of government is to ensure that people are well informed, but that people have a responsibility to make their own choices when it comes to food.
I think the role of government and the duty of the government and politicians is to protect, in this case, the public and children from the excesses and manipulations of the food industry. And we have been dealing for decades, because of those manipulations and misinformation, where we've wrongly thought that sugar was fine when it clearly wasn't. So I would actually disagree with that. And I would say that the science also tells us, Emma, that education is ineffective when the food environment is working against you. The obesity problem is rooted in the food environment. This is a population-wide problem, and therefore you need a population-wide intervention, which means regulation.
According to the Minister, you can certainly have a small amount of sugar, a reasonable, moderate amount of sugar. That is going to add to a balanced diet. What's your specific advice about how much sugar we should be eating?
There is absolutely no role whatsoever of sugar in a balanced diet. The optimal level of sugar consumption, of added sugar, refined sugar, 0. There is no biological requirement. It doesn't do you any good. It should be seen as a treat, and there's nothing wrong with that. There's nothing wrong with having the occasional treat. But I would say that this minister, I think, is misguided. She needs to look at the science, because that is incorrect. It's unscientific. And a message that says you can consume sugar in moderation is like saying you can have cigarettes in moderation as part of a healthy lifestyle. It's completely wrong.
There's been some discussion about changing labelling laws, adding health warnings to things like cans of soft drink, much in the same way that it was done to cigarette packets. Is that a sensible suggestion?
I think it's an important, definitely an important component of that education, if you like, in terms of making these soft drinks, these sugary drinks, less acceptable. And warning labels should be there. I mean, sugary drinks, the consumption of sugary drinks are linked to tens of thousands of deaths worldwide. And in the ideal world, they should be eliminated from the food supply.
In terms of labelling, what sort of things would you like to see?
Well, I think what would be really, really good, and I've been helping and working with film director and health activist Damon Gammo on this, is that what would be useful and what public would find more useful around the labelling is to introduce teaspoons. Everybody understands teaspoons. And the problem is that isn't there at the moment on the products that people buy. And if the teaspoons were put on there, let me give you an example. A typical can of cola has almost 9 teaspoons of sugar contained within it. Yet it's almost 1.5 times the limit recommended by the World Health Organization in terms of what an adult should be consuming per day. And interestingly, almost triple the amount what US guidelines say should be recommended for a 4 to 8-year-old child. So I would say we are really concerned about childhood obesity, more than anything else. And we need to protect children as well as adults.
Is there any traction for the idea of putting the teaspoon labels on things like cans of soft drink?
Well, certainly public surveys in the UK that most of the public would actually want that to happen. So I think that it would be very popular and it would help people exercise personal responsibility. If the minister wants people to exercise personal responsibility, then you need 2 things. You need the right information and you need choice. Right now we have neither, because the information is confusing and because sugar has become so prevalent in the food environment, it's very difficult to make healthy choices. So yes, let's exercise personal responsibility, but help people to do that. And at the moment, we don't have that.
Just last month, we saw Coca-Cola reveal just how much money, many millions, it spends funding scientific research. To what extent is that confusing consumers?
These are companies that are there to sell sugar, to make money. They're profit-making businesses. That is their ultimate aim. And, it's in their interest to fund studies that may deny or may undermine efforts that people are making to try and get sugar consumption down. So, I don't think there should be any corporate influence over science. And I think that distorts scientific integrity. And I think it's a major problem that we're facing at the moment. It's one of the biggest challenges we have, is to combat the harms that come from corporate influence over academics and scientists.
But isn't that to some degree unavoidable when governments around the world are pulling back their contributions to university funding?
Yeah, you're absolutely right, Emma. And in a way, this is a system failure. But we need to have this discussion and debate that what do we do? And people should be aware when information comes out, who is funding it? Where is there an agenda? Is there a financial interest behind either the academics who are writing papers? And this also applies to medical journals as well. And we know there's a big problem in medicine around over-medication. And there's a lot more interest and a lot more awareness now coming out that a lot of the scientific studies that have driven prescription of many different drugs have a big financial interest. And that, for me, as a doctor, makes it very difficult for me to even make good clinical decisions, because I'm using biased information to make clinical decisions on patients who are going to take medications or take dietary advice for their health, and it's been in a way corrupted by vested interest, and that combating that is a real challenge. In its effect, it is ethically dubious for me to be using biased information to make clinical decisions for patients.
Dr Malhotra, we're out of time. Thank you very much for coming in.
Thank you.